Hello everyone, my name is Simranjit Kaur and my lab partner name is Habib Sheikh. Here we are discussing about the antibacterial effect of mouthwash on oral microflora. To compare the antibacterial efficiency of various mouthwashes by measuring the reduction in oral bacterial count in participants after consistent use of over a 2 or 3 week period. Here we are evaluate the antibacterial efficiency of three selected mouthwashes to compare the antibacterial efficiency or activity of alcohol-based versus non-alcohol-based mouthwashes, including their essential oils.
Here are the key points of our wall experiment. The first one is introduction, which provides us the overview of oral hygiene and its significance in oral health. Second one is research objectives, which aim to compare the efficiency of different mouthwashes and formulations. Third one is the importance of oral hygiene. The fourth one is the materials and method we are going to use in this wall experiment. Fifth one is the study result, a presentation of the data collected from the study. Sixth is key finding. Seventh, the conclusion. And eighth, the future expect like potential direction for further research in oral care and product development.
If we talk about the word mouthwash, the first comes in our mind is oral hygiene. Obviously, oral hygiene plays a vital role in maintaining overall health, as the mouth serves as a gateway to the body, directly influencing systematic health. Poor oral hygiene can lead to a range of dental issues, including cavities, gum disease, and even systematic conditions such as cardiovascular disease and diabetes. Traditionally, brushing and flossing have been the primary methods of maintaining oral hygiene. However, these practices alone may not be sufficient to eliminate all harmful bacteria in the mouth. This has led to the widespread use of mouthwashes as an adjunct to brushing and flossing. Mouthwashes are liquid solution designed to be swished around the mouth to reduce oral bacteria, freshen breath, and they provide a protective barrier against plague and many more diseases. Despite their popularity, the efficiency of mouthwash can vary significantly depending on the composition, particularly regarding the presence of alcohol and essential oils. Essential oils such as eucalyptus, thymol, menthol have been incorporated into mouthwashes formulation due to their natural antimicrobial effect and their ability to reduce plaque. These oils can penetrate bacterial cell wall, disrupt cellular function, and inhibit the growth of harmful oral pathogens. The combination of essential oils with or without alcohol presents a compelling approach to oral hygiene, offering a potential balance between effectiveness and gentleness. The significance of this research lies in its potential to enhance oral health practices. Understanding the relative effectiveness of alcohol-based versus non-alcohol-based mouthwashes and the role of essential oil in these products can guide customers in choosing the most appropriate mouthwash for their needs. Furthermore, the result could influence the formulation of future mouthwashes, leads to improved products that better protect against oral diseases while minimizing adverse effects. In doing so, this study contributes to the broader goal of promoting oral health and by extension overall well-being.
Here I am going to discuss the objectives of our experiment. First, we aim to compare the antibacterial efficiency of various mouthwashes by consistently using this product over a 2-week period. We will evaluate how effectively they reduce the oral bacterial count. This will help us identify which formulation are most effective. At controlling harmful bacteria, a key factor in preventing oral infections and promoting overall oral health. Second, we will assess plaque prevention by analyzing the impact on plaque and tartar buildup. Over 4 weeks of regular use, we will measure the plaque index and observe any tartar accumulation. The goal here is to determine which mouthwashes are most effective in maintaining oral hygiene and preventing the early stage of gum disease. Finally, we will analyze the impact of different formulation by comparing alcohol-based and non-alcohol-based mouthwashes. We are particularly focused on understanding the role of essential oils in the mouthwashes. Essential oils such as eucalyptus and thymol have been shown to possess significant antibacterial properties. By examining their effectiveness in these formulations, we aim to provide insights into the benefits of natural ingredients in oral care products. Every experiment have their own importance. So I'm going to talk about the importance of oral hygiene. Oral hygiene is a critical component of oral health, often referred to as a gateway to health. The condition of our mouth can directly influence our systematic well-being, with poor oral hygiene potentially leading to not only dental issues but also broader health complications. While daily brushing and flossing are fundamental practices, they are not always sufficient to eliminate all harmful bacteria from our mouth. So, mouthwashes serve as a valuable adjunct in our oral care, offering additional protection against plaque and gingivitis by reducing the bacterial load in our mouth. However, not all mouthwashes are created equal. Their efficiency can vary significantly depending on their compositions, particularly the absence of ingredients like alcohol and essential oils. Understanding these differences is crucial in choosing the most effective product. This study aimed to compare various mouthwashes formulation to determine which provides the best protection and contributes most effectively to maintain oral. So I'm going to represent the materials and method we use in our experiment. In this study, we tested three different mouthwashes. Mouthwash A, which is alcohol based with essential oils. Mouthwash B, which is non-alcohol based with essential oils. And mouthwash C, which is alcohol based without essential oils. A control group used sterile distilled water. 20 participants were divided into two groups of 10 each, with each group using one of the mouthwashes of the control solution twice daily for 1 week. To evaluate the antibacterial effect, we conduct a microbiological analysis by counting colony forming units on nutrient agar plates before and after the treatment. This allowed us to accurately measure the reduction in bacterial load for each group, providing insight into the efficiency of each mouthwash formulation.
Here we took three types of mouthwash. Mouthwash A is alcohol-based mouthwash with essential oil. Second one is mouthwash B with this, which is the non-alcoholic based mouthwash, and including it is having a essential oil. And mouthwash C is the alcohol-based mouthwash, but without any kind of essential oil in it. And fourth one is our control, which gives us 100% assurity there is no contamination in our whole project. There is two types of method which we used in this study. One is antibacterial efficiency, second one is MIC and MBC. In CFU reduction, we clearly see that mouthwash A having a higher amount of CFU reduction, which is 70%, and mouthwash B have only 65%, and mouthwash C is the least amount of CFU reduction, which is only 60%. And MIC is the lowest concentration of mouthwash that inhibits visible growth of bacteria, while MBC is the lowest concentration of mouthwash that results in the significantly reduction in bacterial count, typically a 99.9% reduction. In results, it is clearly shows that mouthwash C showed a higher MIC value, suggesting it is a less effective at lower concentration compared to mouthwash A and mouthwash B. In terms of MBC, mouthwash C with the higher MBC indicates that it requires a greater concentration to achieve bactericidal effect, which may affect its overall effectiveness in real-world use. In key point, first point is antibacterial efficiency. Our findings state that mouthwash A showed the highest reduction in bacterial count with the 75% decrease compared to mouthwash B and mouthwash C. Second one is plaque and tartar control. Our finding described that mouthwash A was most effective in reducing plaque and tartar with the 40% reduction in the plaque index, while mouthwash B, C, D achieved only a 25%, 35%, and 30% reduction. Third point is alcohol-based versus non-alcohol-based mouthwash. Our finding describes that alcohol-based mouthwash were more effective in reducing bacteria but caused dryness, but non-alcohol based mouthwash were gentler but slightly less effective. Fourth point is impact of essential oil. Mouthwash containing essential oil like eucalyptus had better antibacterial effect compared to those without essential oils. If we talk about the overall performance, then our findings state that mouthwash A, which is the alcohol-based with essential oils, was the best overall performer, achieving the highest reduction in bacteria and plague with fewer reported side effects compared to others. Study, we assessed the efficiency of various mouthwashes in reducing oral bacteria, plaque, and tartar. The finding revealed that mouthwash A was the most effective overall, demonstrating the highest reduction in bacterial count and plaque accumulation. Alcohol-based mouthwashes, while more effective at bacterial reduction, were noticed to cause dryness, whereas non-alcohol-based options were gentler but slightly less effective. Additionally, mouthwash containing essential oil showed enhanced antibacterial effect. These results suggest that mouthwash A, particularly if it contains essential oil, offer the best practice and presence of effectiveness and user expertise. In terms of future research directions, there are a number of topics we have. First is long-term efficiency. Conduct longitudinal studies to assess the long-term effect of mouthwash or oral health, including their impact on chronic conditions like gingivitis and periodontal disease. Second is user experience and compliance. Explore user preference and compliance factors, including taste, irritation, and ease of use, to determine how these influence the effectiveness of mouthwash in real-world setting. Third one is formulation variation. Investigate the impact of different formulations and concentration of essential oil and other active ingredients on the antibacterial efficiency and overall oral health. One is microbiome analysis. Examine how mouthwashes affect the overall oral microbiome, including beneficial bacteria to better understand their impact beyond just bacterial reduction. Fifth one is comparison with other oral hygiene products. Compare the effectiveness of mouthwash with other oral hygiene products such as toothpaste and floss to assess comprehensive oral care strategies. Last one is specific population. Study the effectiveness and safety of mouthwash in specific populations, such as individuals with sensitive teeth, those with braces, or those with systematic health conditions. Sincere gratitude. At last, I would like to express my sincere gratitude to the following individuals and organizations for their support and contribution to this research. First is Professor Narul Hassan for their invaluable guidance, insights, and support throughout the project. Second one is my lab partner, and third is the Centennial College for providing the resources and facilities necessary to complete this project. Thank you all for your time and attention. Our research provides valuable insight into the effectiveness of various mouthwashes and their impact on oral health. We hope these findings contribute to better oral hygiene practices inspire throughout research in this field. If you have any question or need essential or additional information, please feel free to ask. Thank you.